Good morning, everybody. To 8 p.m. last night, nearly 87,000 citizens came forward for testing, and can I deeply thank each and every one of those. We've seen records broken every day, and that is no exception. Regrettably, to 8 p.m. last night, we had 136 cases of local transmission, and unfortunately 53 of those cases were infectious in the community. There is no doubt that the numbers are not going in the direction we were hoping they would at this stage, and it's fairly apparent that we won't be close to zero come next Friday. The crisis cabinet meeting of the New South Wales government met this morning from 8 o'clock, where Dr. Chant and her team advised us that the situation that exists now in New South Wales, namely around southwestern and now western Sydney suburbs, is regarded as a national emergency. And for that purpose and for that reason, the New South Wales government will be taking action in relation to that. First and foremost, the local government areas of both Cumberland and Blacktown local government areas will also be subject to workers not being allowed to leave those communities unless the health and emergency workers are on the authorised list of workers. So unless people are critical workers from the Blacktown local government area and the Cumberland local government area, we don't want any workers leaving that area unless they're regarded as critical workers. The list for what is critical, obviously, or authorised already exists. So we do ask citizens to look at those lists to make sure they don't leave their local government area, which is defined by the suburbs in which they live, unless they work in health, aged care, or are on that authorised list which already exists. Now, can I stress how deeply grateful we are that most of the work that's carried out to keep all of us fed, all of us well and healthy, comes from the southwest and western Sydney suburbs. And we have to acknowledge that and thank all the citizens there. But we also have to acknowledge that we need to contain the spread of the virus. And that is critical at this time, which is why the New South Wales government has, based on Dr. Chant's advice this morning, taken these additional measures. Now, can I stress deeply that we really want everybody to follow these orders to make sure, as I said, that we contain the virus within these local government areas. I also want to stress that from today, the New South Wales government will be calling on the federal government to refocus our national vaccination strategy. There is no doubt that if we want to contain this virus and stop it seeping out to other parts of Greater Sydney, stop it impacting our freedom and our economy, but also stop it spreading into other states, we need to have a discussion about refocusing the national vaccination strategy. Now, what we've done as a government is refocus our efforts in distributing vaccines in southwest Sydney. We have a micro plan for how we will get not only more doses of AstraZeneca in arms, but we also have to acknowledge that that is a very young population in those communities, and we need at least more first doses of Pfizer. So we will be taking to National Cabinet, through the advice of the Chief Medical Officer, our strong advice and recommendation that consideration be given to at least having more people have at least one dose of either vaccine, which reduces transmission. Fortunately, one thing that's become apparent during the last few weeks is that barely anybody with 2 doses of the vaccine is having acquired serious illness. The vaccines are working. That is excellent news. We know the vaccines work in stopping high rates of transmission, which means stopping people spreading it as much as they otherwise would, or stopping people from getting very sick. Now, that has been a green shoot, that the vaccines we have, both vaccines, are working. But we need to get more of them into arms, even if it's the first jab, because we know that reduces transmission, or it protects someone up to 30%. And that is really important, because at the moment, any worker, and again, we know the virus is spreading through workplaces and also through households. And when we're talking workplaces, we're talking things that are necessary. People who work in those critical food outlets, critical distribution chains, unfortunately are acquiring it or getting the virus and taking it home, and then everybody in their family is having it. And clearly, if you have multi-generations in the one household, that has a different impact. But I just want to say to the people of southwestern Sydney and western Sydney that are now most impacted, that not only will the government provide you with additional support, but we'll also be considering over the weekend and early next week measures to provide you support in different ways given the complex nature of communities, and also making sure that we target those initiatives properly. I also want to stress that, that the New South Wales Government, based on the advice of Dr. Chant, will be working hard over the weekend and early next week to provide a roadmap for the people of New South Wales. Our challenge is, as I said yesterday, to live as freely and as safely as possible until we get enough vaccines in arms. So that means that we need to live as freely and as safely as possible during August, September and October. According to the federal vaccination rollout, by the end of October, we will be at a stage where much more of our population will be vaccinated, and we'll be able to live much more freely beyond that point. But we have to provide a roadmap to our citizens as how best we can live freely, but also as openly as possible. Now, the New South Wales Government will be refocusing our efforts to a much more targeted strategy around those local government areas that are most impacted, because we want to contain the spread. But this doesn't mean, as Dr. Chant says to us all the time, and to me personally, this doesn't mean that if you live outside those local government areas, you don't have to be on high alert, because this virus is spreading everywhere. We've seen now sewerage in northern suburbs and elsewhere, where again, through workplaces, people are unfortunately either getting the virus or spreading the virus and then taking it home. So just because you don't live in those 5 local government areas we've been focusing on doesn't mean you can't get the virus or spread the virus. But our focus remains containing it within those areas, but also reducing transmission in those areas and allowing people in those communities to live as safely and as freely as possible. And I can't stress enough that we will be redoubling our efforts to think innovatively and outside the box as to how we can get direct support to people on the ground in those communities. But I just want to stress, and I'll use the words Dr. Chant used with us only this morning, that she regards what is happening now in New South Wales as a national emergency, and our government will be responding accordingly. But please also know that where there are opportunities for us to open up, to ease restrictions, to let the economy undertake its necessary work, we will do that. But we will have a clearer view next week on what August, September and October look like for our citizens around the state. And our strategy remains to keep the virus obviously out of the regions and allow the regions to continue doing what they're doing. But our strategy also involves having a much more targeted and localised approach, as well as looking at other parts of Greater Metropolitan Sydney and what adjustments need to be there. But there is no doubt that we believe very strongly that we need to refocus the national strategy on vaccine rollout, given the situation New South Wales is in. We need to administer at least the first dose of any vaccine into arms as much as possible. And we also need to acknowledge the population of southwest and western Sydney is younger than the average population, and we need to consider that as well. And I will be raising these issues at National Cabinet, as Dr. Chant will with her counterparts. Dr. Chant will now give her health update, and then we'll take questions. And I also want to say that tragically, as we see more cases develop, we will also see more hospitalisations and more people in intensive care. And regrettably, we did have an additional death overnight, which I've only just learned about, and we'll provide more information during the day once we're confident that family members have been advised. But I just want to foreshadow that unfortunately we're going to see more of this as the case numbers increase. But what is the key to our freedom, the key to us living freely and as openly as possible, is getting more jabs in arms and containing the virus and not allowing it to spread further, which is why, in particular, we've extended the stay-at-home orders for particular workers in those Cumberland and Blacktown local government areas. The Cumberland local government area is about where Liverpool and Bankstown are in terms of the spread. Blacktown isn't yet, but in order to contain the virus, we're extending it to Blacktown as well, so that we can have a containment strategy for it not to spread in the same concentration to other parts of Sydney. But I want to stress that just because you don't live in those 5 local government areas doesn't mean that you won't be impacted. And a final message, because we took this decision recently, we have reached out to community leaders very quickly, but I just want to stress that if we haven't had a conversation with you yet, Please know that that conversation will come. We did our best in the last half hour to contact as many people on the ground as we could, but in the interest of time and to get the message out about the seriousness of the situation, we wanted to make that announcement now, but we'll make sure that that information is filtered out to everybody on the ground. Dr. Chan.
Thank you, Premier. So New South Wales recorded 136 locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and there were 86,620 tests. Whilst there were no deaths recorded in those data, as the Premier has said, tragically, an 89-year-old male has died, and we won't be releasing further information until we've ensured that the family are aware of that case, and my condolences to that family that's impacted. The actions taken to date have averted many cases, but what we're not seeing is the turnaround that we would have liked to see at this stage. LGAs. Every day, people from those LGAs have to go out to work to keep our city going. They are doing critical food production, critical work to keep society functioning. And we are seeing cases introduce the virus into various workplaces. We are also seeing significant household-to-household transmission, and it's been very challenging to interrupt those transmission chains. So the two areas that I've requested that we urgently focus on is redirecting all vaccine initiatives to southwestern Sydney and Western Sydney, particularly the affected local government areas, that we work in partnership with the Commonwealth to deliver both Pfizer and AstraZeneca, consider the use of the Pfizer in the younger working population, in order to prevent the spread. Now, the rationale is that I've talked a lot about the individual benefits of vaccination. The individual benefits of vaccination are so clear. Both vaccines are very effective at preventing against severe illness and hospitalisation. And I can't urge the community more in a broad scale to take up any opportunity to get vaccinated. We also know that, as I indicated, that the group of workers that keep the society going is this group of workers in the 20 to 49-year-old age group in southwestern Sydney. Under 40s would not have been routinely eligible for vaccination in terms of Pfizer, and what I've recommended to government is we urgently do mass vaccination of those workers to stem the transmission risk. We know the vaccines do that because they reduce the risk. If you're vaccinated, even one dose, it reduces your risk of onward transmission. And so that, again, is an additional strategy we need to put in place. I would also like to say that I've advised that we also need to work very closely with the impacted communities and leave no stone unturned in terms of the support we can provide people, recognising the reasons that they may have difficulty isolating or following the public health requirements. And can I just say, my heart goes out to the people in southwestern Sydney and Western Sydney for the impact this virus is having on them. In terms of the suburbs that are impacted by the updated list, I'll read out the suburbs so that people actually are aware of it, because they may not be familiar with their local government areas. So the suburbs that are under the stay at home will be Cumberland, Marylands, Greystanes, Guildford, Pendle Hill, Girraween, and then Seven Hills and Blacktown. So they're the new areas that we've added, remembering that we have the other Fairfield local government area and County Braxtown government area and Liverpool local government area already with only authorised workers leaving those facilities. So my key message in summary is we need to follow the public health advice. I can't stress this enough, that the actions taken in locking down, reducing mobility, wearing masks indoors, wearing masks outdoors when you come anywhere near anyone, are all effective strategies. We need to stay the course, and I know that that is very hard for people, but we need to stay the course. But what I've also recommended is we need to do more. We need to redouble our efforts, and I've indicated to the government that we need an intensive vaccination program using both Pfizer and AstraZeneca in that area. And I would recommend to anyone across New South Wales to make a booking for AstraZeneca and to get their dose of AstraZeneca regardless of where they live, whilst we are developing a very targeted and intensive strategy in that southwestern and western Sydney.
As you just heard, Dr Chant has indicated to the New South Wales Government this morning that this is now, in her view, a national emergency. In a national emergency, every citizen has a duty to do what they can to defeat whatever is happening to us. In this case, it is a Delta variant of the virus. Can I just remind citizens, particularly in southwestern and western Sydney, that that duty would absolutely be addressed if you would go and get vaccinated. If you're over 40, you can get vaccinated in any one of our state hubs. State vaccination mass hubs. We have spaces available. Can I also remind you not to listen to the scaremongers? Understand, for example, that if you're over 60 and you get the virus, you have a 1 in 200 chance of dying. If you're over 50, you have a 1 in 500 chance of dying if you get the virus. As opposed to that, if you have the vaccine, the AstraZeneca vaccine, it protects you to the extent that your chances of actually dying are 1 in 2 million. There is no argument. You should step forward and have the vaccine. I implore the people right across New South Wales, but particularly in southwestern and western Sydney, which is the epicentre of this national emergency, to step forward and have the vaccine.
Premier, what is a national emergency? What is a national emergency? What does it trigger?
Yeah. The health advice we received from Dr Chant, and allowed Dr Chant to make further comment, is that we have an obligation on behalf of the nation to contain the virus. If we don't contain the virus, there is critical work that goes on between states. No matter how hard you have a state border lockdown, the virus still seeps through. No border is perfect. There are always exceptions. And that's the point we want to make. That's the point we've made in New South Wales from the start of the pandemic. No matter how hard you make your border closure, it doesn't prevent, with the exception of WA, which is very segregated from the rest of the nation, it is very difficult to contain the virus within any boundary because there's critical work, there's distribution, there are compassionate grounds where you have to allow family members, especially when there's a very serious family situation, to move around. So it is a national emergency based on the advice of Dr Chant, because unless we contain the virus, not only will we have a challenge in opening up parts of our economy that we want to open up, in terms of allowing our nation to function the way that it can, we need all hands on deck in terms of refocusing our national vaccination strategy. And we know that in some places around Australia, there is 0 to very few cases or 0 cases. We need to get at least the first jab for as many people as we can in those affected communities as possible. And that's why we're asking for a refocus of the national vaccination strategy. We've already put some requests in, which we understand are being considered, but we need a refocus. That means using all vaccines available, including the AstraZeneca. I've had the AstraZeneca jab. The Chief Medical Officer, Dr Chant, has. Minister Hazzard has. My parents have. The AstraZeneca is a very, very effective vaccine. So we are redoubling our efforts in using up the supplies of AstraZeneca that we have, but we also have to acknowledge there is a much younger population in those affected communities, and we need to also refocus the national vaccination strategy to getting at least one jab, the first jab of Pfizer in some of those demographic cohorts, to prevent the spread, because no matter what we do, no matter what extent of restrictions you put in place, there are people that make sure the rest of us are safe, have food, have the items that we need, and they need to be able to continue to work.
So you're asking other states. So you're asking other states to.
And
so you're
using
asking
the special powers that come with that. Have you considered declaring a state of emergency?
Well, in effect, we already have that with this outbreak. We, in effect, already have that. But simply, I'll allow Dr. Chant to further explain her advice. But the advice she provided to us this morning was that her concerns that what is going on in New South Wales has the impact of affecting the rest of the nation. And for that reason, she wants us to up the ante in relation to a national refocus of the vaccination strategy, to refocus into those key local government areas, into those local communities. The New South Wales Government has done that already. We have a strategy for maximising use of the AstraZeneca in our communities. We've already spoken to the pharmacists about opening pharmacies in the southwest and Western Sydney, and I'm grateful for the pharmacists for doing that. We already have the GPs on call to provide extra doses as well. Through our vaccination hubs, we've increased our vaccination hubs and points of access as well. We're talking to businesses about on-site vaccinations. But what we do need is a refocus of extra doses, and that's why we will continue to have those conversations. That is the bottom line. We need a refocus of additional doses to get as many people in that community with at least the first dose as possible, because even with the first dose, it reduces your chances of spreading it to as many people as we're seeing occur now.
We need to. When you say national emergency, though, like that conjures images of troops on the streets.
No,
are you going to reconsider the federal offer of army support?
What we need more than anything else is first jabs in arms for people who haven't been vaccinated. That is our priority. That is the
power does it trigger.
This is very important information, so please allow me to finish my sentences. It is very important for us, based on Dr. Chant's advice, to get those first jabs in arms as quickly as possible, and I will ask Dr. Chant to repeat the advice that she's spoken about and then repeat the advice as to why this is a national emergency. And can I say our priorities are twofold: containing the virus and making sure people don't leave home unless they absolutely have to, making sure people are following the rules. But more importantly, the vaccination strategy needs refocusing. That includes in messaging around the AstraZeneca. That includes getting more doses of first doses of Pfizer into arms. And I will ask Dr. Chant to repeat the advice she's given here and also the advice she gave the New South Wales Government in relation to the national emergency.
Thank you, Premier. So I've been very clear that I've been very concerned that the case numbers have not seen a decline despite intensive lockdown measures. In looking at how the transmission is occurring, we have seen transmission continue in households, amongst household groups, and we are still seeing some mixing of household groups, but also some community spread from points where people have to actually go and get food, supermarkets and other settings. The other elements of the transmission is occurring in workplaces, and these workplaces are not the hairdressers or the discretionary premises. They're premises that actually put food on the table for people in Sydney. They're the people that keep us supermarkets stocked. They're people that are working in food processing and other settings. Because of that, my view is that we need to get vaccines into younger people in southwestern Sydney. And as the Premier indicated, southwestern Sydney and parts of Western Sydney have some of the lower levels of vaccination coverage, which poses another challenge. And so we need to redouble our efforts at supporting that community have access to vaccinations. We need to vaccinate younger people between that 20 and 40-year-old age group that are that workforce, that are doing those critical jobs. And we also need to maximise jabs of AstraZeneca anywhere we can get them. And that is my strong advice. Now, it is for two purposes. One is to reduce transmission risk, to complement our other strategies. So this is not that the lockdown isn't working. What we would have seen if the lockdown was not in place would have been skyrocketing exponential growth in numbers. But what we know is we're not seeing the turnaround we would have liked to see, or the flattening as quickly as we would like to see it. So we need to add new strategies. There's no point continuing without taking the time to pause, reflect, and look at what else we can do. So the two elements of this are vaccine and our vaccine strategy, and the second element is working with communities on the ground in a grassroots level to support them in being able to comply with the public health advice. And if that's about enhancing food delivery, working with community local government areas, working with NGO sector, we just need to do a lot additional activity in that, and that's been put in place through.
Have you told the Prime Minister
to tackle this national emergency? By how soon do you want to see those first doses going out into arms?
I want to see them today. So let's be very clear. My sense of urgency is absolute urgency. So I think we need to be seeing vaccines in arms on Saturday, Sunday, Monday, and we need to be ramping up to roll out vaccines in those areas, as well as urging everyone across Greater Sydney to also take up the opportunities afforded to them in terms of access. Can I just say a couple of things? Sorry, didn't mean for that to sound a bit screamy, but it's very hard when there's lots of raised voices. In terms of AstraZeneca, I have had AstraZeneca. My husband, who I do care for dearly, but has not seen much of me, but has had his first dose of AstraZeneca. And my mother-in-law, who again I care for dearly, who's been making food for me, looking after us before, we haven't connected since we weren't permitted to, but prior to that, has had her 2 doses of AstraZeneca. So I just want to say that the Chief Health Officer would not recommend AstraZeneca to someone that they care about if they had concerns that the risks of AstraZeneca are infinitesimally small compared to the benefits. So can I just be very, very clear that we need to correct the mythology about AstraZeneca, and in the context of the Delta threat, I just can't understand why people would not be taking the opportunity to go out and get AstraZeneca in droves. And that's what I'd like to see. But I also recognise that younger people, who are the mobile people, who keep our Sydney functioning, Greater Sydney and the state functioning, reside in those local government areas, and the age distribution, they have not had the opportunity. Most of them have not had the opportunity to be vaccinated. And that's why I'm arguing that we need to use Pfizer for those young people to stem that transmission chain, because we know that that will provide individual benefit them, but also prevent them spreading it on. And what we're seeing is that people are bringing it into their households and then infecting their older relatives. And I think that, you know, regardless of your age, also consider AstraZeneca. Have that risk-benefit discussion, and it may be that if you're in a particular hotspot area, you are concerned that you might bring it into your home and infect your grandmother, and you may be very comfortable after going through risks and benefits to make that decision. So my clear message: anyone over 40, go and get vaccinated. Anyone under 40, consider it. If I was living in some of those areas, I would certainly be having AstraZeneca. And I think we need to think about this very seriously.
Why wouldn't it curb youth in some of those settings?
Look, government is considering the best advice at every time, and it's not just from me, it's from where our mobility is happening, intelligence from police, what are the activities. We know a lot of workers in that area actually keep Sydney working 24/7, so we need to factor into that. But the way that we are seeing transmission happen is this a few things. Inadvertently, as soon as one case gets into a household, everyone's infected, and that's because of the Delta virus. You are infectious even before you've got symptoms, so you just don't have that luxury of separating people. They're already been exposing them. So that's one of the things. And the household size is quite large in many of the families because they're multi-generational. We're also seeing that we are still seeing some intermixing of households, and I can understand that. The hardest thing is not to have connectivity with your broader family. But at this point in time, that's potentially dangerous. And the other element we're seeing
Does that happen at
is
night,
what.
Dr. Chen? The visiting hours?
No,
is there
it's
a lot
not.
of activity
It's
at
not
night?
a particular issue at night. We're talking about interactions. So again, we'll assess the information, but I don't know that it's a particular night phenomenon. But any intelligence, we look at the case interviews and try and get information, and we use that information every day to target the messages. As I've said before, for instance, the fact that you can spread the disease when you don't have symptoms was something we got that back from the community, and that's why I've pushed it out and we've tailored the messages. So it is an iterative cycle to look at what are the issues associated and driving transmission, and let's try and work with the community.
If you are that desperate for anyone who can to get AstraZeneca, why is it not available at the state hubs? I know the Premier said yesterday that it was about consent forms. Why can't they have that few-minute conversation? A lot of people don't even have a regular GP, so what would be the difference?
Look, I think that we can look at all of those strategies. What I'm trying to say is that at the state hubs, we've had many bookings for AstraZeneca go wanting. And there's plenty of people, if you look at the data, people over 40. There are a lot of people over 40. So whilst I accept that, we were hoping to see our bookings surge, because I think I've been giving the message around AstraZeneca for many weeks and reinforcing the importance of vaccination. So those hubs, we will certainly look at whether we open them up more broadly. We had thought that going to the GP would have been the best strategy, but we can certainly rethink anything. But there are bookings in the hub. So if people are having difficulties, we can provide it. If you go through the eligibility checker, there are a number of New South Wales hubs in Sydney Metropolitan, at the Sydney Olympic Park, and also in the local district in Macquarie, places like southwestern Sydney, that have got a lot of free bookings that people can take up that opportunity.
There's a lot of people in regional New South Wales. We've had this sewage detection in the Byron Bay. A lot of GPs in those areas are refusing to give people under the age of 40 AstraZeneca. And you have state hubs out there or state-operated clinics where people under 40 cannot get AstraZeneca.
So we will be very keen in working with GPs to look at whether that would increase access. I think we're open to all suggestions about increasing access if you've got some information about the barriers. And we would also want to reach out to those GPs to understand their hesitancy and the particular circumstances, why they're concerned about giving AstraZeneca, noting that this is really about a risk-benefit discussions, and patients' autonomy or request after being taken fully through the information should be, in my view, respected, and they can take on risk, the risk of the very small risk of an adverse effect once they've been taken through that.
Premier, I know that Premier.
Every day we're hearing, do the right thing, don't engage with people outside of your household, don't see friends or extended family, yet we're still allowed to exercise with someone outside the household. How does that work? Is that counterproductive?
Mental health is extremely important, and we have to have an outlet for the community to safely address mental health issues, and exercise is one of them. And the orders around exercise are very clear. You can exercise with your immediate household or with one other person, so long as you're doing it in a safe way. Now, we have to rely on the health advice on where the transmission's occurring. The transmission is occurring in workplaces all hours of the day. It's occurring within households all hours of the day. But most importantly, in order to contain the virus moving forward, we need to get those jabs in arms. And can I also stress this point? There is no doubt that some settings are much more effective than others. When I say settings, some restrictions are much more necessary and more effective than others. And that is the assessment that we will take moving forward. I want to be very clear on this point. I want our citizens to have hope that we will have a very targeted approach to life moving forward. And this is really important. There's no point for symbolic reasons locking down or having more restrictions if we don't think they're going to work. Every time we announce or ask the community to do something, it's because we think it will have an effect, or if anything, it will prevent thousands and thousands of extra cases. So please know that it's not useful just to make a symbolic gesture of an announcement. You have to make sure that what you're announcing, every time you ask the citizens to be burdened, it has to be for a medical purpose. And the reasons why we've taken the decisions we have to date is to prevent thousands and thousands of cases which we've managed. But what we haven't done is reduce the trend and see the trend decline in the number of people particularly infectious in the community. And because that challenge hasn't been met, we have to refocus our strategies, and certainly the refocusing of that strategy involves talking to the federal government about our vaccination strategy across the nation. Because when Dr. Chant advised the New South Wales government this morning that in her view it was a national emergency, that means we have to discuss the national strategy for the vaccination rollout, including the advice provided. Please know that we've offered AstraZeneca in our hubs to over 40s based on that advice. And there's millions of people who are over 40 in New South Wales. Can I make that clear? There's lots of AstraZeneca available. If you're over 40, there is no reason today why you shouldn't be getting the AstraZeneca. Please know, like Dr. Chant, both of my parents have had it. Many of my relatives have had it. So please know that if you're over 40 in New South Wales, and yes, whilst we're focusing on those 5 local government areas, please be clear, as we've said, that you should be considering getting the AstraZeneca anywhere you live in New South Wales if you're over 40. And of course, at this stage, if you're under 40, go through your GPs. I understand GPs have capacity for AstraZeneca as well, and that's why the New South Wales government proactively approached the pharmacists, and thank you to the pharmacies who've come on board already, especially in south-western Sydney and Western Sydney. Our pharmacists will be key lines of defence in making sure that we get those jabs in arms. So, but what it also does require is a refocus on the national strategy. For example, if we can at least get more Pfizer into first doses for those younger cohorts, the ones that are moving around, the ones that are providing food on our tables, that will go a long way in reducing transmissibility.
So will you be asking for other states to give up their allocations of Pfizer to be sent urgently to South-West
Well, I
Sydney?
think they are conversations we need to have in National Cabinet. We need to at least have a strategy in National Cabinet that does think about the options for getting more jabs in arms in Sydney, especially in those 5 local government areas. And that's why we're raising the issue. And Dr. Chant advised us that it's a national emergency. Her advice also included having a rethink of the national vaccination strategy. We need to work collectively on this. This is not just a challenge for New South Wales, but a challenge for the nation. And I just say that we have been doing the heavy lifting for 18 months in keeping the virus at bay. We've tried to make sure that we keep the economy going, and we want to continue to do that. But in order for us to have our citizens live freely and openly, as well as other states to ensure that their citizens live openly and freely, we need to have a national refocus, and we appreciate and we will continue to work cooperatively with the federal government. But it was my obligation to provide that advice to the public as soon as we received that advice from Dr. Chant this morning. It would have been inappropriate or irresponsible for me not to convey that advice that I received from Dr. Chant this morning, because I want the community to be aware and ready for whatever decisions we need to take next week. But I also want to stress again that our citizens should look forward to how we can live as freely and as safely as possible in August, September and October, because by the end of October those huge supplies will be here in New South Wales, but we have a gap in the next 4 to 6 weeks. And we need to make sure that we get as many jabs in arms as possible between now and then.
So when you say you want to get more first
Excuse me, if you're a bit courteous to each other and just ask one at a time, we'll get through the questions.
Prime Minister that you were announcing a national emergency today?
Well, certainly what we've done in recent days is through the Health Minister, through our health officials and through other channels of the New South Wales Government, convey to the federal authorities our keenness to have further conversations about the national vaccination strategy. That has been apparent. But what the advice we received from Dr. Chant this morning was that she regards this now not as only a threat to contain it within New South Wales, but she sees threats to other states, and for that reason she gave us that advice, and I'm conveying that to the public, in that in order to contain the virus within those local government areas within New South Wales, we need a consideration of a national reconsideration of the vaccination strategy. The advice Dr. Chant gave us is that our ability to contain the virus is directly linked to the national vaccination strategy. And that is the information we're conveying today, that the emergency we have in New South Wales is directly linked to the national vaccination strategy, but also could impact other states if we don't have a national focus. And we're not talking about resources that we don't need. We're talking about doses. We're talking about jabs in arms. That is what we need. And we are doing everything we can as a government to make sure that we maximise, in particular, the use of AstraZeneca as much as possible. But we need clear messages around the nation on what and how to do that, because our citizens will gain confidence not just in what Dr. Chan and I are saying, but what everybody is saying about the AstraZeneca vaccine. We need clear messages around the AstraZeneca vaccine and getting that information out. But practically, we also need additional, at least first doses of Pfizer, because we know we have a very young cohort, that those particular parts of Sydney have very young populations compared to the rest of the state. In fact, compared to the rest of the nation, some states have much older populations. Other states can rely on AstraZeneca more than we can. Of course, we're encouraging everybody over 40 to go through their GP or come to one of our hubs. And there are millions of people in New South Wales that are over 40 years of age. Can I make that point? There are lots of people in New South Wales in their 40s, their 50s and their 60s that don't have any vaccine. We're saying to everybody, please get vaccinated. If you have any concerns, go to your GP. Otherwise, book with us. We have capacity for more AstraZeneca. We have capacity for people to come forward, whether it's through their GP, through the pharmacists, or through our own hubs to get the jab. So we're saying to anybody... Yeah. I'm sorry?
Did you tell the Prime Minister before you walked out here that you were going to declare a national emergency in this press conference?
Well, I don't have the capacity to address anything beyond the boundaries of New South Wales. What I am simply doing today, it is not my job to comment on anything beyond what is my responsibility as the Premier of the largest state of the nation. But when my Chief Medical Officer says to me, Premier, this is, I believe, an issue of national emergency, not just New South Wales, because our emergency is linked directly to the national vaccination strategy. It's about clarity of message around the AstraZeneca. It's about thinking about how we can get more quickly at least first doses in the arms of those people in those affected local government areas, especially those providing critical work. But I want to say this. I say to everybody, please know that the New South Wales Government is working hard in the next few days, not only to have these conversations through our federal authorities, which we've already started. Can I make that clear as well? We've been working hard, very hard behind the scenes in having these conversations with our counterparts federally. And I want to thank the federal government to date and their authorities for the constructive conversations we are having. But it would have been irresponsible for me to hold on to that advice and not convey that advice that my Chief Medical Officer has provided me, and the sense of urgency we have in refocusing and redoubling our efforts, and also considering the fact that where other states are in relation to the Delta and where New South Wales is, and having a national focus on the vaccine rollout strategy. That is all we're saying. And I believe we'll continue to work closely with our counterparts. Our intention is always to work closely, but my job also is to highlight the concerns raised to us by the Chief Medical Officer, to say plainly and clearly to the people of New South Wales what we will be doing in terms of taking action. But I also want to allay any concerns. Please know that we are not the type of government, and I'm not the type of Premier, that's going to be asking citizens to do things we don't think are going to have any effect, right? So whenever I get questions about curfews or exercise or whatever else, the facts are that will not change the dial. That will not reduce the number of cases. You can ask me all those questions night and day that you like, but I'm not going to sit here or I'm not going to put any imposition on the community which isn't going to have the desired effect. You've already asked a question. Guys, at least respect each other. Just ask a question. Yeah.
When you say the focus is on people getting their first dose of the vaccine, does that mean delaying their second dose, especially in the case of Pfizer?
Yeah,
would you rather have more people 30% protected?
Yeah, I'll ask Dr. Chant to answer that question.
Look, can I also just say a big thank you to the Commonwealth. I know at an officer level there's been lots of discussions about it because we have a shared interest. whilst we are states and territories, we actually work really well together in disease control, and it's really important that we see ourselves as a connected system. And that's the basis for my language about a national emergency. We need to work together across the states and territories and Commonwealth and tackle this. In terms of getting Pfizer into arms and getting AstraZeneca into arms, we need to think of all options. I've already indicated to you that for a while I've been recommending a reduction in the interval between the AstraZeneca and bringing that down to 4 weeks. And that's because, notwithstanding you may need a booster shot, what I want is people to be maximally protected at this present time. The other component is Pfizer, and it may be that we have to make hard choices. I mean, this is a very hard situation, and we may have to make decisions to delay the Pfizer interval to out to 6 weeks. You can have it out to 6 weeks to actually bring forward doses. We might have to accept that any vaccines that are held off for a second dose administration that you might have kept because you've delivered the first dose, that we actually trust the supply chains because we've got that latitude of the couple of weeks to bring them forward. So at this point, there is an urgency to get as many jabs in arms, and I think we need to work creatively and pragmatically with all the states and territories in the Commonwealth on what that looks like. Now, can I just express the fact that some of those changes will impact on individuals? It may be that we need to cancel your bookings, but we have to make these hard choices if we are going to see these numbers stabilise first and then decline. And I see vaccination, as well as the maintenance of the hard lockdown, as key strategies for us to minimise the human impact of this disease. And can I just urge the community, there is access to vaccine out there. We have got bookings available in our system, and I know GPs are working very hard to get vaccine out.
Last question, please. Last question, please. They said we still need. And what do you think about schools returning?
So look, I've been a really strong advocate for schools returning. In the first wave, we commissioned research around it about how schools could get back and understand transmission. With Delta, we know it's more transmissible virus, and I think we need to be clear about any impact that returns to schools will have on mobility, and we're looking through that. So it's premature. That's a task for the weekend, where we're looking about, is there any leeway anywhere in relation to schools? And I just want to let the community know I understand how hard it is to do the homeschooling, but it is an important contribution to reducing that mobility. And can I just urge parents in those affected areas also to comply with the sort of guidance that schools are directly issuing to you.
How many children are currently being treated?
So in terms of the surveillance testing, at the moment we're still focusing that on Fairfield for any worker that leaves. Fairfield is still generating the largest number of cases. In Canterbury Bankstown, we are also asking for aged care workers and healthcare workers to be tested. We have to acknowledge that our testing resources are finite. And at the moment, we've got about 82,000 or we're getting up above 80,000 every day. We're starting to max out at that, and what we've got to weigh that against is the ability for people with symptoms to get diagnosed and to get fast turnarounds. So I think that the community would understand that we have to make those difficult prioritisation choices, and they're not things that we can easily call on assistance or redirect because of the particular rate limiting steps of equipment and other things. But let the community know that we are working on access to new technologies, like the role that industry can adopt in terms of point of care tests, and we know that some of the point of care tests perform really well, and so working with industry to look at how that can be put in place. We've also got rapid testing capability that we're standing up, particularly in the affected areas, to try and make sure that some of that testing only takes 20 minutes with a PCR test. So we are looking at mixed strategies. Some of them are not visible publicly because they're more targeted to particular workplaces and settings.
Final question. Can you please confirm how many children are currently being treated for COVID? And if they have
Sorry, can I come to you in a sec? Can I just go to Charlotte first?
Two questions.
Older Australians have the lowest risk of dying from AstraZeneca and the highest risk of dying from COVID. Despite that, we're still seeing 1 in 4 Australians over the age of 70 waiting for Pfizer. Is it fair to ask those Australians...
Sorry, 1 in 4 what?
1 in 4 Australians over the age of 70 are waiting for Pfizer. Is it fair to ask younger Australians to still be second in line to those when we do eventually see an increase in Pfizer?
Can I just say that the short answer here is there is oceans of AstraZeneca in New South Wales. There is also vast amounts of virus in southwest and western Sydney. All we're saying here at the moment is your obligation to yourself, to your community, to the New South Wales and indeed to Australia, because this could leak further into other states, is to go and get the jabs of AstraZeneca. I appreciate what you're saying, but it's really just about getting the vaccine that's available. Yep.
Thank you, Minister. This might be one for Dr. Chan.
Oh, sorry, sure. Yep.
How many children are currently being treated for COVID and how many of those have underlying conditions?
I'll have to take that question on notice. I think one of the key characteristics we've indicated about this outbreak is that we're seeing quite a significant number of lower age groups impacted, and that's certainly been a feature. So we'll get that information for you. It is reported publicly in our EPI report, but I know there's a bit of a lag in that EPI report. So we'll get that for you.
Guys, can quickly, Lucy and then that gentleman at the end. Yeah.
What will your request to National Cabinet be today for how many Pfizer doses and how soon do you want them here?
Look, our request has already gone through officials. Our request includes clear messaging around the AstraZeneca to make sure that we utilise all the supplies of AstraZeneca that we have, and clearly the goalposts have changed now. We are in the middle of a serious outbreak. And the risk of dying from COVID is much higher than having an adverse reaction to AstraZeneca. And given that those goalposts have changed, we need clear messaging around the nation about AstraZeneca, but in particular to give our citizens confidence, especially if you're over 40. I've had AstraZeneca. The health advice previously said over 60. I'm only 50, and I had the AstraZeneca. And so I'm appealing to everybody that Dr. Chan is, for me, the most respected medical person in Australia in public health. If she is saying it's okay for over 40s to have AstraZeneca, please take that advice. The risk of any adverse condition from the jab is minuscule compared to the serious illness you can get if you get the COVID virus and you don't have any dose of the vaccine. So I would urge everybody to please follow that health advice, and we implore that to be national health advice, that we can make sure we have as much use of AstraZeneca as we can. Now, beyond that point, if you are someone that wants the vaccine of AstraZeneca under 40, of course you can go to your GP, but we will also reconsider if there's opportunities for us, given the national messaging around AstraZeneca, if we can go further in our own hubs. We want to maximise the use of AstraZeneca. But also, what we'll be asking is for a consideration of the Pfizer vaccine. As Dr. Chant said, we would prefer to have more people have at least one dose of Pfizer than hold back the second dose, rather than have more people without any vaccine whatsoever. So currently there's a process through the national process, the vaccine rollout, where you obviously give the first jab and then the second, and you ensure the second jab is available. So from a medical perspective, we're asking for consideration of that. We're also asking potentially for reconsideration of any additional supplies that can be brought forward to New South Wales to support us, because it is a national issue. If New South Wales can contain the virus and stay safe, our nation can, until we get those vaccination rates
Premier,
up.
the New Zealand government's just announced a 8-week pause on the trans-Tasman bubble because of the Delta variant. Do you take a personal responsibility for that virus starting off here in Sydney? And what do you say to the thousands of New Zealanders who are now stranded?
Oh, look, the New Zealand government has been very consistent in their policies, and we respect their policies. And this is a virus that's affecting the whole world, and we shouldn't think that we're any different.
Thanks, everyone.
On the
Last question.
On
Yep.
the AstraZeneca messaging, I know the Minister was asked about this yesterday, but given the seriousness now, has the state government, have you considered a New South Wales advertising campaign that's very blunt, just do you want lockdown to end, get jabbed? Simple.
We are, but it's important for us to make sure that the medical advice and the messaging around AstraZeneca is consistent around the nation, and that's why we're asking for a refocus on that advice, because we are one nation and we do need a national vaccination strategy which has consistent messaging around vaccines. But we want to be very clear. Dr. Chant has said that if you're over 40, there is no reason you shouldn't be getting the AstraZeneca. If you're worried, if you're concerned, go to your GP. And there are millions of people in that category. There are so many people in their 40s, in their 50s, in their 60s that don't have any dose. And we're saying this is not the time to sit back. This is the time to lean in and get the vaccine. If you have any health concerns, of course, go talk to your doctor or you're in a different circumstance. But for the vast majority of us who are relatively healthy, there is no reason why we shouldn't be increasing that. And thank you, everybody, for today.
Thank you. Thank you very much. Thank you.